Is there any hope for people who suffer from spinal muscular atrophy? Can science provide a lifeline despite the challenges? You can take heart knowing that new medicines, as well as enhanced nutritional and respiratory care, offer hope for longer lifespans, particularly for people with severe forms of the condition. Did you know that SMA affects infants and young children, depriving them of muscle strength and mobility? Let's find out. Spinal muscular atrophy, a genetic inherent neuromuscular disease called spinal muscular atrophy (SMA), results in weakening and degeneration of the muscles. Most commonly affecting infants and young children, spinal muscular atrophy (SMA) impairs their ability to use muscles. Neurons in the brain and spinal cord break down in your child with SMA. The brain stops signals that direct muscle movement. Your child's muscles weaken and contract as a result, and they may be unable to sit independently, move their heads appropriately, or even walk. In certain instances, as the illness worsens, they may experience difficulty breathing and eating. Your child's SMA diagnosis will determine the severity of the condition, as there are various types. Treatments can help your child live longer in certain situations and improve some symptoms. But there is no known cure. Researchers are at work to combat the illness in novel ways. Remember that the experiences of each child or adult with SMA will vary. Your child is not less intelligent as a result of the illness, regardless of how limited their range of motion is. Socialization and friendship making will still be possible for them. Is there a possibility that SMA will run in families? Well, let's see. SMA is a condition passed down via families. If your child has SMA, it's because they have two copies of a faulty gene, one from each parent. When this happens, their body will be unable to produce a certain type of protein. Without it, the cells that govern muscles will perish. If your child inherits a defective gene from only one of you, they will not develop SMA, but will be carriers of the illness. When your child grows up, they may pass on the faulty gene to their children. Have you ever been curious about the latest developments in the management of spinal muscular atrophy? Let's dive into the details. There is currently no perfect treatment for SMA. However, the identification of the genetic cause of SMA has resulted in the development of a number of treatment options that target the genes associated with the condition. These include two medications: risdiplam, Evrysdi, and nusinersen, Spinraza, and gene replacement therapy, Zolgensma. These are types of gene therapies that modify the SMA-related genes. Your body can produce a protein that can aid in controlling muscle movement by following the instructions provided by the SMN1 and SMN2 genes. Nusinersen, Spinraza. This treatment alters the SMN2 gene, allowing it to produce more protein. It is applied to those who have SMA of all ages. The medication will be injected into the fluid surrounding your child's spinal cord by their medical team. This can take up to 2 hours, including preparation and recovery time. It must be done multiple times, with a follow-up dosage every 4 months. Research indicates that approximately 40% of users benefit from it by becoming stronger and delaying the progression of their illness. Onus of no gene, abiparvoic ZOA. Zolgensma. To do this, the faulty SMN1 gene must be replaced. Children under the age of 2 use it. A tiny tube known as a catheter will be inserted into an arm or hand vein by your child's medical team, an IV. Next, a particular subset of motor neuron cells will receive a copy of the SMN gene via the tube. This task will only require one execution. Studies have shown that onasemogene, abiparvoic ZOI, aids children with SMA in meeting development milestones more quickly, such as head control and independent sitting. Risdiplam, Evrysdi. This therapy prevents the SMN2 genes from interfering with the production of proteins, enabling the necessary protein to reach the nerve cell. After eating, your child gives it to themselves once a day. Their weight determines the dosage. In clinical trials, 41% of participants reported better muscle function after 12 months. Promising new treatments for SMA are still under development. To test them, clinical trials are necessary. The main objective of SMA communities worldwide are raising the standards of care and increasing the range of available treatments. Combination therapies are being investigated in a number of clinical trials. A case-by-case analysis may reveal additional benefits. Emerging themes in clinical research and trials are being highlighted by these trials. Treatment options such as improved SOC and therapeutic options alter the landscape and phenotypes of SMA. The path to improve results for SMA patients continue with ongoing research and work. People are working together to create a future where everyone finds strength in the face of adversity and resilience prevails over hardship. Let us know your thoughts about the video in the comment section below. See you all in the next one. Until then, goodbye.